Dr. Khan. So I've done 100% total capsulectomy, 328-23 EP. I cut out the excess skin that really will add to the aesthetic contouring. And then, as you can see, some areas relatively thin, some areas thick. I'm very happy with how the whole dissection went. And as you will see, this is a relatively small implant. Blood loss was minimal. Now, this is very important to show. Textured implant. Intact, super small if you ask me. This is your McGann. Now normally it says on it, just says McGann, but no volume amount. A patient's at 200. So I'm going to put it here. One thing I like to always show. See this? This is your gel bleed. We'll do a video afterwards. This is the badness that's leaching in, and you can see, look at some areas of the capsule. Super thin, you can see my blue glove. All of the capsule has been removed, and you can see a lot of inflammation that's present. That is certainly part of what is the textured implant. And again, over here, look, some areas very thin. I'm just going to go right here. Look, you can see my scissors. Complete removal of the whole capsule. No inflammatory burden left behind. Again, same thing. It says, now what's interesting on this one, again, it says 195 on this one. So the imprint is 195 on this one. And again, if I go like this, put it here, look. This is the problem. The gel bleed with any implant, be it saline, silicone, and certainly the texture. Look, some areas relatively thin. Look at that white band on the inside. So I have had to remove all of this tissue in the periphery, and the body itself does a good job protecting it. So implants always return to the patient. Capsules always sent to pathology. Rule out the PLLC, CD30 analysis. Rule out lymphoma, rule out malignancy, rule out any abnormal pathology. Cultures for aerobic, anaerobic, and fungal. And complete removal of all the badness, which is the 100-100-0 rule. 100% of the time, 100% of the capsules should move, but 0% of the capsule remaining behind. This is Dr. Khan, Executive Plastic Surgery.